Hello, class. So today we are going to be shifting from combat medics into their main category, which is military medicine. So when we're talking about military medicine, we're looking at some articles that were written about military medicine from The Guardian, which is a British newspaper. Time periods that the articles were written was from 1990s into the early 2000s. The articles that we're looking at, there is one that's actually written about with some interviews from World War II, military medicine who were at D-Day. We have the introduction of buddy care during the first Gulf War. We then have how they're talking about how they don't believe that they were ready during the first military medicine was ready for the first Gulf War, and then we're looking at a point where they're actually talking about some Russian doctors during who were taking wounded back from Chechnya. And then the last one is we're looking at the an article that's talking about the Afghan conflict, and it's a MASH hospital. This one that I kind of brings into the fact of the multi role of the medic. So very beginning, we're actually the first article looking at World War II and this interviews with these individuals. One of the unique things, of course, is the fact that this is a field hospital that's set up to actually stabilize the patient so that they can get moved further back. What really drew me to this article was the fact that they were talking about how they actually were having their medics go out and use penicillin, which was something that we talked about last week. And that was something that's kind of unique because it gives an idea of the scope of practice that medics are able to do back in World War II and were allowed to actually dispense antibiotics. The next article is looking at that whole chain of life, that I brought up last week as well, which we got the we're giving first aid, teaching the troops how to provide care to their buddy who's been injured and get them wholly stabilized enough for the medic to come along to stabilize them a little bit more, to get them back to the collection point in the field, and then that collection point to the field hospital back to so on and so forth as they work back the chain of command and through the chain of care. Next one that we're actually looking at is how they mentioned that they were this this medical personnel did not feel that they were ready, which is something that keeps coming up in everything I keep bringing up. But this is something that we also, if you look into a lot of medicine's never ready for war. And they're always playing catch up and adapting to keep up with the effects of war. Last one that we're looking at, this kind of looks at that whole multifunction role that medics have. Medics are when they're talking about the Afghanistan, you see a multi-role that they actually serve. I was a Air Force medic myself. As an Air Force medic, I was not out on the battlefield. I did not face that danger, but I got back wounded. When I actually was taking in patients from Panama right off the flight line, and they were coming from. I knew a guy who was actually down their front line. He was actually patching them up. He was getting them to the flight line. Flight line was then flying them back. Then they were coming from the flight line to Wolford Hall, and then of course Fort Sam Houston, the two major medical centers here. And we were actually functioning as a MASH hospital during that time period. And this is kind of a unique thing. This is kind of looking at the way a care progresses. And this is kind of all these articles show this area where you have the whole chain of care. And this is what kind of makes them very unique